Okay. So this is take one.
Take one, yeah. Practice.
Practice, okay.
Yes.
So thank you for taking a video, Cory. Today, I'm going to talk about one of the key issues in healthcare system in Japan by using this slide, which is fragmentation of healthcare providers in Japan. In Japan, most hospitals have a wide array of specialization in one hospital, which might sound good because patients have a better access to very specialized care. However, the downside of this is that there are only a few physicians and a very small number of patients in each hospital, and which means that there are not sufficient number of patients for one hospital, and actually it is very possible that this is dragging down the efficiency of healthcare providers in Japan. And let me take an example from PCI. And PCI is one of the advanced medical surgery for heart attack. And in Japan, there are so many facilities that can conduct PCI, as shown in the left-hand chart. In the left-hand side chart, in Japan, there are 8.1 facilities that can conduct PCI per million population, which is twice higher than that of the other developed nations. However, to the right of the chart, as you can take a look at here, the average number of patients per facility is only 107 in Japan, which is less than half of other nations. And the issue here is that because there are very limited number of patients per facility, it's very difficult for a hospital to develop the best skills, the best capabilities for the procedures. And this is shown in the right-hand side chart. On this chart, we show you the result of a study on the correlation between the number of patients per hospital and their outcome. And this study's researchers divided the hospitals that are conducting PCI in Japan into 4 groups based on the number of patients per hospital. And the number of the PCI patients are represented on the top of the chart. And as you move from left to right, the number of the patients increases. And then the researchers compared 2 key outcome indicators for PCI. One is in-hospital mortality, and another is post-operative length of stay. On the upper chart, we show in-hospital mortality. If in-hospital mortality rate is low, it means they have better outcome, as there are fewer patients die after the surgery. And on the lower chart, we show post-operative length of stay. And if the post-operative length of the stay is smaller, it means that they have better outcome, because patients can discharge earlier. And I think that you can immediately identify the clear trend that if the number of patients in the hospital is higher, the outcome is better. And this study implicates that, if hospitals have sufficient number of patients, they can develop the best capability for the procedure. But the problem in Japan is that it looks like that some of the hospitals do not have enough number of patients to build up their capabilities for this, build up the best capabilities for these procedures. And actually this is a recommendation I'm going to talk later, that Japan needs to promote consolidation of healthcare providers. But for today I would like to stop here, and I just want to leave with you the thought that the Japanese healthcare providers' very fragmented situation is loss of efficiency. And thank you for your attention, and I'm happy to answer any questions or any comment you might have.
All right, thank you.